ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਸਿੱਖ ਚੈਨਲ ਦੇਖ ਰਹੇ ਸਾਰੇ ਦਰਸ਼ਕਾਂ ਦਾ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਸਵਾਗਤ ਹੈਗਾ ਆ। 2020 was supposed to be start of a new decade, a decade that brings new hopes, new aspirations, technology, development, infrastructure, and so much more. The whole world was expecting a lot out of this new decade, but little did people know that within 3 months, life would change forever. Not for one person, not for just one community, not for just one country, but the whole world. The whole world would finally get together in something. But it had to be of this nature. It had to be a disease to get us all together. Today, we have a very special guest joining us from World Health Organization, Regional Office for Europe, Dr. Masoud Dara. Doctor, welcome to Seek Channel. Thank you for taking your time out for speaking to us.
Thank you very much, and a good day, a good afternoon, good evening to you and your viewers.
Thank you, Doctor. As I was speaking to you before the interview, Doctor, a lot has been already said about the virus, the coronavirus. You know, a lot has been speculated. So much information is out there in the public domain. People have 100 kinds of instructions. There's so many myths to be busted. There's just so much. And this whole year is only about switching on the television and listening about the virus. But then in day-to-day life, you know, there's still so many things which aren't clear to the public. So before we begin with our general questions and answers, I would like to ask you, how has it been for you sitting there at a position where you have to deal with information regarding the virus on a day-to-day basis at World Health Organization? How has life changed for you work-wise since the virus has come into existence?
Yeah. So the World Health Organization, as you know, is a specialized agency of the United Nations, which is responsible for international public health. Here at the Regional Office for Europe, following communicable diseases together with my team, and obviously traveling a lot to the countries, to visit hospitals, to visit facilities, to talk with the ministers of health, healthcare workers, patients, and so forth. So the first impact of COVID-19 was a limitation to travels that we had in terms of addressing the other communicable diseases than COVID-19. That was a major change that they have in terms of the travel restrictions. But on the other hand, of course, it's also created the challenge created also some opportunities to see how we could make sure that the services are more people-centered in European countries, particularly, as you know, for example, over-hospitalization has been always a major problem. Now many patients can be treated ambulatory. So there's a kind of adaptation to the services that has been ongoing. So to make a long story short, the most important impact, I would say, that we need to adapt our situation to the facts. If we cannot travel and invite everyone for a meeting, then we organize virtual meeting. And the same also the team members, and to make sure that we have enough physical distancing from each other and we not contribute to the distribution or further dissemination of the disease. So adapting ourselves has been the first and foremost important, I would say, impact of the COVID-19. Over.
Right, Doctor. And you were talking about the impact and the changes in the life and how travel restrictions and meeting with people has changed. But, you know, in day-to-day life, people have also been introduced with the face mask and face coverings, and people are still trying to adjust with this, you know, new accessory in dressing with them. But then there's still a lot of questions around face masks. Who should really be wearing it strictly because they are quite vulnerable? Who can leave it a bit, and you know, who are more vulnerable, who are not? So can you please clarify this whole confusion around face mask? Should one be wearing a face mask when out in public?
So all that depends also on the context. So depends on the epidemiological level, depends also whether we have all other elements in place. So having a face mask is just like doing a safety belt when you're driving. It is not enough to have a safety belt and then drive fast. So you should make sure that you have a good roads. You should make sure that you also drive carefully, and you should also make sure that you do also your safety belt. So it's very important to also to acknowledge the transmission of the COVID-19. The virus is mainly transmitted, I would like to highlight on that one, transmitted through the droplets and the surface. So closer you are to the other people, the source of infection, the higher chance of the infection going to be distributed or disseminated. So very important to have a physical distancing, and we do not call it social distancing because we want to make sure that people are together, not physically, but mentally, and also supporting each other in terms of solidarity. People are not left behind. So that's very important, physical distancing, and a very important hand hygiene. Major routes of transmission of the disease is when people touch the surface, touch the areas where the virus exists, and bringing it with their own hands to the face and mouth, and where basically the virus can be entered. So these are the major routes, and of course masks also have an extremely important role because they will avoid further transmission from the people who are infected by coughing, by sneezing to others. So first of all, you protect others, but also if you properly use masks, because it's extremely important to use it properly, to also, for example, do not touch it too often, or if your hands are dirty, do not manipulate the mask. That can also protect yourself because then you remember yourself that if I'm outside, I'm touching the surface, I'm not going to again touch my nose, my mouth, and etc. So that's kind of a protection effect that it has mask. So I would say it is recommended based on the epidemiological situation for majority of people to use when there is a physical distancing is not possible. Over.
Right. That's very enlightening information, doctor, because there's so many misunderstandings going around, and there's still so many myths to bust about the virus. What would you like to say on that? What are some common misunderstandings that WHO has come across, and they're trying their best to give proper information regarding specific misunderstandings to the public?
From very early on to have a public information as and also brief the whole world at the same time simultaneously. So keeping the world informed on the right information is crucial. Now we are also living in the area of social media. People use Facebooks and other social media platforms, and of course there can be small mistakes or even some myths that can be disseminated among everyone. So this is a completely new virus that is entering to the human population. Obviously, we have to get more information, but also the right information. So if you get the wrong information and share it with others, then it can lead to more disinformation. There are many examples of that one. We have actually put on our website a platform where you can already look at those myths, and we call it basically the demystifiers. What are the demystifiers that you need to consider? That are already presented also in our website that I would highly recommend your viewers to go and check those.
Definitely. I'd like to inform our viewers of the WHO, World Health Organization website, which is www.who.int. You can go over WHO website and read all information regarding coronavirus, obviously. But doctor, a lot of time we read on headlines that women of Asian background are more prone to the coronavirus, especially if they're pregnant. They are in their higher risk than the white community. The people from ethnic minorities, people from poor backgrounds, they are at higher risk. But then there has not been any concrete explanation about why is that. So could you please tell us about why ethnic communities and people from poor backgrounds are especially at risk from the virus?
First, I would like to also highlight that basically virus does not discriminate, so they can infect anyone, and does not show actually respect any border, so it travels everywhere. But very important, as you rightly mentioned, is that specific communities, migrant population, those who are living in the poverty, and also other determinants that higher risk of getting the disease because of the living condition, because of, for example, the nature of the work they do. For example, if you're in the industry that you're cleaning the buildings, or you're a driver, so you're exposed more to the virus in the community. So the minorities are more exposed from one side, but on the other hand, there are also other determinants which explains higher mortality among some ethnic groups. For example, diabetes, blood pressure, and other diseases are also more common in some of the ethnic groups. And of course, that, as you know, of course, unfortunately, not only they are more at the risk of getting the COVID-19, but also they are more prone to develop the more severe form of it. And the examples, for example, in Germany from the abattoir also showed the same examples, that migrants have to live in a very close area because of the work condition. And of course, when they want to save money for their families. And of course, that actually can lead to the poor living condition and higher risk of the transmission among them.
Right. And is there anything different that they should be doing then? Some different kind of measures that they should be taking than the rest of the people if they are more at risk?
The recommendations we give is for everyone, but particularly if you're exposed to you have a carrier that is exposed more to population. So it's very important to make sure that you protect yourself with the physical distancing. You make sure that your clients or your people you work with them and yourself to show a good example, to wear mask. You also make sure you have a good hand hygiene in place. Regularly wash your hands. Try to touch your face as less as often possible. And cleaning, washing hand properly, very important, or using also hand disinfectants regularly. These are the measures that you can take to protect yourself and your family. Over.
Yeah. Doctor, a lot of our viewers are originally from India. They have families there. They visit India every year. So, with India easing the lockdown despite a spike in cases, what do you expect is going to happen in future with countries like India who have relaxed the lockdown to a great measure, but then there's still cases, number of cases increasing?
Lockdown has been a very good measure to decrease the transmission risk. And yet you have seen example of the countries where they restrict the interaction of the people among themselves, then they manage to bring the transmission rates down. But also very important to not to forget that the economy also needs to be running, because if the economy is not working, if there's a high unemployment, there will be also impact on the poverty and also the hunger. So it's very important to have a good balance in terms of how you want to open up the country to make sure the economy is running, but people in the meantime are not having the risk of going to the large number of transmission in the communities. So it's very important that each country should make the decision based on monitoring the situation, knowing the real number of the COVID-19 with a good testing, but also have a multi-pronged approach, simultaneously increasing the public health attention awareness with all the measures that I mentioned in terms of decreasing the risk of transmission, but also do stepwise opening up the country. And if there's the issues that you see the numbers going up, maybe you need to go back and then limit some of the opening up. So it's, in terms of priority, obviously, for example, some jobs like supermarkets or those work in food sector, these are needs to be prioritized, but also take some measures in the workplace to decrease the transmission among the colleagues that are working in there. So the stepwise manner, opening up, this is what is needed, and also monitor and adapt your measures accordingly.
Right. Those were some really useful steps that you recommended, Doctor. In your opinion, after this pandemic comes to a close, what do you think that we as a global community should do to avoid any such other pandemic that might be around the corner?
Important element is to make sure that we invest on health. And that is one lesson we are all have all learned from COVID-19 is that there's nothing more important than health. So investing in health system and making sure you have good healthcare services that is detecting as early as possible, good laboratory services, good surveillance, but also good treatment facilities so we have less mortality, but also more research. Obviously we need more research in the zoonotic diseases that transmitted between animal and human. That would be the first thing that we need to do, but also good preparation of um, our response in the country level. And very important also solidarity. We are all in this together. So there is no border and say that this is only a question of the south or north or west or east. We're all living on this planet, so we need to also work together for improving the health system across the world, and hopefully we will not have any more this kind of huge pandemic in the future. But if it's going to happen, we manage it at the source and also have it controlled timely. Over.
Right, Doctor. Very well said. Obviously, we have to have a solidarity. Everybody needs to get together and fight any such pandemic. God forbids if there's any next one. But then, testing wise, Doctor, a lot of countries have started trace and track testing system. So I wanted to ask specifically, is there any other way of testing as well? Are there different types of tests available? And if there are, then what's the difference between them? And how do you know which one to apply to which kind of population and which community?
So again, this is, as I mentioned, is a new disease. So we need to look at the tests that are giving us the highest yield. The test that we do, of course, is based on the getting the sample of the virus, the RNA, the sample, a genetic sample of the virus that needs to be taken. But also there are other kind of tests which is looking at how the our immune system is responding. So all these tests needs to be carefully balanced and also knowing in terms of their yield. But at this level, the most important measure that we need to do to have early testing and accurate testing, which is including that contact tracing. So anyone who has symptoms that the things that is related to could be COVID-19 should come forward for testing, but also have a good contact tracing to know once you have a person who has been positive, with whom this person has been in contact, and do the active trace and contact tracing among those people. And also I would like to draw your attention on another area, which is you're talking about COVID-19, but we should not also forget about other diseases, diseases like tuberculosis, like HIV, even like cancers. So this is true, it's natural that the people are a bit concerned, maybe should not come to healthcare services because they may get infected. Yes, if it's something that you can delay, come later is fine, but if you delay too long and if you have blood pressure, if you have unfortunately some of the risk factors that like diabetes or coughing for 3 weeks, it could be tuberculosis. So very important message that I would like to pass to your viewers: take your health serious, consult. Maybe you don't need to go to the health services, call them. These are my symptoms, what should I do? Because that's very important, and that's another concern that we have, that we see that the less number of other diseases being detected. It doesn't mean that they don't exist, but unfortunately people don't come for detection. Put your mask, contact your healthcare facilities, go to them, do the testing for other diseases that you may have, and start treatment. And I wish everyone healthy lives, of course.
Definitely, Doctor. I would also like to urge our viewers once in Punjabi as well that ਜੇ ਤੁਹਾਨੂੰ already ਕੋਈ ਹੋਰ disease ਹੈਗਾ like diabetes ਹੈ, cancer ਹੈ, ਜਾਂ blood pressure ਦੀ ਬਿਮਾਰੀ ਜਾਂ ਕੋਈ ਵੀ any other disease ਤੁਹਾਨੂੰ ਹੈਗਾ ਆ ਤਾਂ ਜ਼ਰੂਰੀ ਨਹੀਂ ਹੈਗਾ ਕਿ ਤੁਸੀਂ ਟੈਸਟ ਸੈਂਟਰ ਜਾਣਾ ਹੀ ਆ but at least call your doctor once and confirm with him what are the steps you can take and take their advice in the midst of coronavirus. Is it safe for you to visit them, or if you can wait? Doctors will be able to advise you best. But just because coronavirus is there, you should not forget or ignore your already existing medical conditions. So, Doctor, we read in the news every day, all the major superpowers of the world are racing to get a vaccine, made by the end of the year. Somebody says before Christmas. But then, do you think really the timeline for development of the vaccine can be shortened?
It normally takes several years, up to 6, 7 years, to develop a vaccine, as you know. But now, with the science being so much advanced, that as you mentioned, there's a race to get the vaccine. There are some candidates which is already being tested, but we need to see also the impact, whether it's effective. It's not enough to give the vaccine if it's not fully effective. And the efficacy of vaccines are different. For example, for TB, we have 60% efficacy of BCG vaccine. But for example, for polio, we have much, much higher. So it really depends on the efficacy. And the efficacy can be known once people are exposed to the disease. They're vaccinated, they're exposed to disease or the virus, and then we can see that how many people are protected. So this needs really time. And of course, as long as we do not have treatment, we cannot, it's not ethical to put people on purpose in contact with COVID-19 to see whether the vaccine is effective or not. So these are the things that is a need a practical arrangement, and we all do hope that the new vaccine would be here soon. But in advance, we need to make sure that the vaccines, once they're produced, is considered as a public health good. It means that it should be accessible for the people around the world. As I mentioned, the world will be safe when everybody is safe. So that's the reason WHO has been working with all the partners to have a plan, basically, to make sure that once a new technology is available, it is available and accessible for the whole world population. And many partners have been working on that one. European Union, as well as other countries, have been working on the solidarity to make sure that the new technologies would be available for everyone.
Right. Definitely, doctor. And I was reading that even this morning has said that we cannot really put an end to such pandemics until we don't stop exploiting the wildlife. And then there is this new study which says that we are not sure if herd immunity actually works in the case of coronavirus. So my point is that even after 6 to 7 months now, there's still every day that we're learning something new about the coronavirus. So, in this kind of situation, when there is a new thing coming up every day, what are some really crucial lessons that we have learned from this whole coronavirus coming into in the world, lockdown, self quarantine, and whatever happened, whatever followed after that? What are some crucial lessons that we as people, and secondly, in the medicinal field, that we have learned from this whole episode?
The most important lesson is that we do need to have solidarity from the first day. So it is not enough to close the borders, because the world is so connected that any communicable diseases can be transmitted very fast across the borders to all the countries. That's the first lesson I think that we have got from the COVID-19, which I'm sure is also makes a big turn in terms of how we see the world. We are one world, and there is no border for viruses and the infectious diseases. That's very important. And the very important element is also that we need to invest more on health and preparedness across all the countries. So the health system strengths are very essential, and healthcare workers, they are the most essential people in the health system. So without having the doctors and nurses who are sacrificing their lives, and unfortunately, many of the healthcare workers has been perished due to COVID-19. So it's extremely important to retain, but also protect them, to give them the right equipment, to protect them when they're working in the facilities. So these are the most precious assets of every country, their healthcare workers. I would like to salute them now from this tribune to make sure that thanking them and also wishing them all the safe. It's very important, that lesson learned, that we make sure that protection of equipment available, they're well safe, very important in terms of access to the protective equipment that they would need. Over.
Yeah. And doctor, last but not the least question. Everybody keeps talking about this new normal. Everybody's missing the normal that we have just left. Everybody's missing how they could take going out for granted. So, what do you expect from this new normal? How do you expect the world would look in this new second innings of the world?
I think that the new norm would be the fact that we'll be more digital, and the new norm would be that we foresee the challenges and health system challenges that we need to address. So the digitalization, I think, would be a very, very important element that we need to consider as a kind of new norm, but also the fact that we need to take care about all communities across the planet. I think that would be also a new norm. Protectionism would not be working in the long run. So I think that would be the new norm that, as UN Secretary General mentioned, we need to consider as one world inhabitants and working together.
Yeah, yeah. Thank you so much, Doctor. It was really a pleasure to speak with you. Anything, any message in the last for our viewers of the Seek channel that you'd like to give?
I would like to greet once more all your viewers and wish them all the health. Take good care of yourself. Make sure you do the physical distancing when possible. If not possible, make sure that you do the mask, use the mask. Hand hygiene, extremely important. Good nutrition, eat healthy, and as all Indians are already famous with the good food and lots of fruits, and try to make sure that you take care of your health. That's the most important element. And also contact your healthcare facilities if there are issues that you need to have help and you need to ask their advice. Make sure that you link to the health services and link with your communities. Take care of each other, and let's not leave anyone behind. Thank you.
Thank you. Thank you, Doctor. I would also like to add one thing. Please do not believe everything that's said to you. Please stay away from myths. Do not believe anything from unreliable sources. That is very important and advice. And with this, we'd like to thank Dr. Masoud Dara, who joined us from World Health Organization Regional Office for Europe. He was really busy and especially took out time for us. Thank you so much, Doctor. It was really a pleasure to speak with you. And hopefully for everybody in Seek channel, प्लीज अपना ध्यान रखो और मिसअंडरस्टैंडिंग मिथ्स तो दूर रहो अपने हैंड्स जेडे ने वॉश करते रहो सैनिटाइज करते रहो एंड फेस मास्क यूज करना ना भुल्लियो ਇੱਥੇ ਹੀ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਨੂੰ ਫਤਿਹ ਬੁਲਾਉਂਦੇ ਆ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ
Paul Jewellers, the largest jewellers in Birmingham, established since 1978 with 3 showrooms on Soho Road and West Bromwich High Street. We have all the latest wedding and occasion jewellery from traditional, antique, contemporary and stonework. Competitive rates, buy and exchange gold, custom orders are also available. Paul Jewellers, style, elegance, glamour where it matters.
I would like to thank all the drivers, especially Abdel.
Thank you, Malcolm.
Thank you, Vincent.
Hey, Gabriel. Thanks for driving me home safely from the hospital the other day.
And for making yourself available to help.
I'd like to say thank you to Mohammed.
A big thank you to Podesta, my driver.
Thank you to all the Uber drivers who made sure that I arrive at work and return to my home safely.
Thank you so much. I'm forever grateful.
Thank you, Tarek.
Big thank you to Abdi.
Thank you very much for all your hard work.
ਪਾਕ ਸੁਪਰਮਾਰਕਟ ਜਿੱਥੇ ਘਰ ਵਰਗਾ ਮਾਹੌਲ ਫ੍ਰੈਂਡਲੀ ਸਟਾਫ ਇੱਥੇ ਆਟਾ ਤੇਲ ਘਿਓ ਦਾਲਾਂ ਹਰ ਤਰ੍ਹਾਂ ਦੇ ਮਸਾਲੇ ਸਾਫ਼ ਸੁਥਰਾ ਤਾਜ਼ਾ ਫਰੂਟ ਸਬਜ਼ੀਆਂ ਤੇ ਹੋਰ ਖਾਣ ਪੀਣ ਦਾ ਸਮਾਨ ਹਮੇਸ਼ਾ ਘੱਟ ਕੀਮਤਾਂ ਤੇ ਮਿਲਦੇ ਨੇ ਆਪਣੀ ਸ਼ਾਪਿੰਗ ਕਰਨ ਲਈ ਹਮੇਸ਼ਾ ਯਾਦ ਰੱਖੋ ਇੱਕੋ ਇੱਕ ਨਾਮ ਪਾਕ ਸੁਪਰਮਾਰਕਟ ਕੇਪ ਹਿਲ ਬਰਮਿੰਘਮ
ਸਾਊਥ ਹਾਲ ਦੇ ਦਿਲ ਵਿੱਚ